Hi, my name is Dr. Ross Hauser. Thank you for watching. I get a bunch of emails, so we do our best to answer the emails. I think it's good, common emails, just to talk about them and try to together figure out what's the best hope for healing for this person. The question that the person asked was, is ankylosing spondylitis a condition that you can help with prolotherapy? Ankylosing spondylitis. As most of you guys know, prolotherapy is designed to take an unstable joint and then make it stable. Whenever you see the word ankylosis, it means that something is fused. So in other words, if somebody has pain because of ankylosing spondylitis, like they have an ankylosing spondylitis because it involves often the fusion, if you will, of the sacroiliac joints. That's often where it starts, but then it goes all the way up the spine. So once there's ankylosis, in other words, there's fusion, there's bony fusion of the areas, they're not a prolotherapy candidate. So in general, ankylosing spondylitis is best treated by a comprehensive natural medicine program. In other words, the person gets on like an anti-inflammatory diet, a very wholesome diet, which often is mostly vegetarian. And sometimes it's called pescatarian, where you use fish and just vegetables, and you eat a very, very clean diet. Then the person also gets under the care of a good chiropractor that can help the person with posture, because you got to realize ankylosing spondylitis is a progressive disorder usually, and you want to make sure that the condition, the person will fuse. If they are going to fuse, they fuse in a really good alignment. Like my program director, who's back when I was in residency, the person had ankylosing spondylitis. Well, it turned out the person fused in this position, because again, the disease can cause fusion all the way up the spine. So making sure that you have really good posture. So that means that if you have a job working on the computer and you have ankylosing spondylitis, you have got to be upright. You have got to be upright looking at your computer screen, even have your computer screen a little bit up. So that way when it fuses, if your neck fuses, because often it fuses with the person looking down because they're all the time on the cell phone, or if you're sitting too much, the person's going to fuse like this. Now, I should say that there have been times where a person with ankylosing spondylitis where I did do prolotherapy, because just because a person has ankylosing spondylitis doesn't mean every single ache or pain in their body is from ankylosing spondylitis. So somebody who definitely has a diagnosis and has bony abnormalities, bony fusions that are evident on MRI, then you definitely have ankylosing spondylitis. Then if a person with ankylosing spondylitis is in a car accident, you might need prolotherapy because you might have gotten ligament injury. But if the pain is a dull pain, that clearly is from ankylosing spondylitis, then a natural medicine program with good posture, good exercise program, getting under the care of a chiropractor that can keep the posture and the spinal alignment as best you can would be the way to go. That'd be the best hope for healing. If you just got the diagnosis because you got a bone scan or something and it showed inflammation at the sacroiliac joint, so in other words, you got a bone scan and it showed that there's inflammation at the sacroiliac joint, I definitely would come in for a consultation, because there are times where sacroiliac instability causes abnormalities on bone scan which appear like ankylosing spondylitis, but it's not that. It's actually instability caused by ligament injury, and the best treatment for chronic ligament injury is prolotherapy. As most of you know, prolotherapy causes a strengthening and a tightening of the ligaments, and then once those ligaments get tight, the person has stability. Then there's no more irritation, inflammation in the lower back, and of course the pain goes away. So in summary, I just say for true ankylosing spondylitis, the treatment isn't prolotherapy. The best hope for healing is to get under the care of a good person who knows about functional medicine or natural medicine, proper diet, and then somebody who understands good structure, which could be a chiropractor, a good manual therapist, and then the person will optimize their chance for really good functioning and health and wellness. And that's, of course, all that we want for the person. Thank you so much for watching.